Welcome friends, thanks for joining me. This is Dr. Rajeev Kurapati. I live in US, I practice medicine, I practice hospital medicine, I see patients who are admitted to the hospital, inpatient care. I'm also trained in lifestyle medicine and integrative medicine. Today's topic is CRP, C-Reactive Protein. Some of you may have heard about this test, some of you may have had this tested, and some of you in medical field know what is this about. So today's topic is very briefly about what is CRP, what is it used for. C-reactive protein is an inflammatory marker. See, when we test our body for these blood tests, they most often than not, these blood tests tell us something about the state of your health, right? Whether something is abnormal, something is normal. C-reactive protein is a protein made in the liver, and it goes up with inflammation in the body and it comes down when the inflammation reduces within the body. When do you see inflammation? Any stress to the body, physical and even emotional stress causes inflammation to go up. We know that for a long time that there is a thing called inflammation. For instance, in patients with COVID, inflammation is the main culprit for a lot of death and disease and disability because of the COVID, causing inflammation. So how do you measure it? One of the tests that is commonly used is called CRP, C-reactive protein. The other commonly used test is called ESR, erythrocyte sedimentation rate. I'm not going to go into that. Today's topic is CRP. It is produced in the liver, goes up with inflammation, comes down as the inflammation decreases. There is another subset of this CRP called high sensitive CRP, high sensitive C-reactive protein. A level of less than 2 is considered normal. Above 2 you see in low inflammatory states such as what we call low cardiac output and so on. Low cardiac output is when the patient, for whatever reason, has decreased heart output and the body has to work harder to maintain its physiological needs like digestion, activities, excretion, physical activity, what have you, enzymatic activity within the body. A level, this is high sensitive CRP. A level of 3 to 6 is considered moderate inflammation within the body, and a level of above 10 is considered high levels of inflammation within the body. You see this in septicemias, which when the body has sepsis, or heart attack, what we call myocardial infarction, or high cardiac failure states, heart failure states, and so on. So you see this level of high sensitive CRP going up above 10 in patients mostly admitted to the hospital who are really sick, patients who are in ICU. So you test this and you know the patient has very high inflammation. You see CRP and other inflammatory markers going up in osteomyelitis, which is a type of infection. Sometimes you see that in states of cancer, sometimes you see that in gout, and so on. So basically, if you suspect inflammation and you want to quantify it, simply saying that there is inflammation is not enough. We know in medicine we want to measure and test things, and to quantify the level of inflammation, you get CRP, you treat the underlying problem and you track the CRP. And for example, in COVID, I have seen hundreds and thousands of COVID patients. One of the common tests we do, one of the common biomarkers or biological markers, blood tests we do when patient gets admitted to the hospital is to test for CRP. And we even track this CRP every 2 or 3 days and see if the inflammation is coming down or going up. If the inflammation is going down, we know that the body is reacting nicely, the body is recuperating and the infection is coming down. So this is one test that I do commonly in the hospitals for COVID patients. So some of the functional medicine doctors you might have seen, functional medicine doctors are the practitioners who test a lot of enzymes, who look for digestive function, who look for microbiome, enzymatic activity and so on, and they test this high sensitive CRP, and they consider even mildly elevated, even levels of above 1 considered to be an indicator for low grade chronic inflammation. And in fact, low grade chronic inflammation has shown to be the main culprit behind many diseases like autoimmune diseases, dementia, atherosclerosis, diabetes, hypertension, chronic kidney failure, many chronic diseases, obesity and whatnot. So these functional medicine doctors use even lower levels of high sensitive CRP to gauge the disease progression. And sometimes physicians or clinicians use non-steroidal anti-inflammatories such as ibuprofen, naproxen and things like that to reduce the level of inflammation within the body. Sometimes they use steroids. In fact, this is not a good practice. You can use this in acute situations like patients in ICU, patients who are very, very critical, whose blood pressure is dropping, things like that. You can use steroids, but usually in chronic low-grade inflammation, if somebody is recommending steroids, be careful about that. Steroids have a lot of side effects. It may not be the right way of using steroids for chronic low-grade inflammation. In fact, you want to address the underlying medical problems, underlying causes such as eating low quality food, highly processed food, which is low quality food, and exercise, stress reduction, sleep, social connections. All these things help reduce the chronic low-grade inflammation. I hope you understood something about CRP and high sensitive CRP, and the next video we'll see something about magnesium and other topics related to health and well-being. Till we meet next time, stay healthy and stay safe.